Now, New Zealand will enter phase 2 of the government's Omicron response at 11:59 tonight as COVID-19 numbers ramp up. But some industry players say the system is, quote, a complete nightmare and warn it could end up creating super spreader events. So joining me now is New Zealand Food and Grocery Council CEO Catherine Rich. Catherine, thanks for your time this morning. Why a complete nightmare?
Well, in terms of getting your hands on the rapid antigen testing, they could not have set up a more bureaucratic process, really. In order to be able to get one, workers, not the businesses, have to front up with at least 6 different pieces of paper, letters, IDs, order numbers, texts. And so that's why we argued that it would be better to put these rapid antigen testing and the systems in the hands of businesses. That said, I did hear yesterday the Prime Minister said that perhaps for larger businesses they could do this. If they don't, then they run the risk of large numbers of workers who may be close contacts, leaving their place of work, going right around the community to pick up these individual tests. There's a much more efficient way of doing this.
So how would it work if, say, a supermarket worker tests positive, all of their close contacts who they've been working with over a day, which could be quite a significant amount, maybe 20 or 30 people, what would they have to do to go and get their rapid antigen tests?
Well, at least there's been a bit more honesty about how those close contacts are identified. For a long time, it's been the businesses that have had to do that because they've waited days and days to hear from the Ministry of Health, the public health folk, to be able to work with them on that. If things aren't changed and streamlined, the process will be this. You'll have to leave your place of work. You'll have to have a critical services register letter. You'll have to have a letter from your employer. You'll have to carry forms of ID and your vaccination pass. You'll have to have a text from the ministry, and you'll have to have your RATS order number. And for people who are trying to get on with their work and just keep going so they can keep their shelves full, that's quite a long list of bureaucratic material before they can get the test. It would be much better if as we thought, that the tests would be dispatched to businesses, so the test could be done there and then. It would be more efficient, it would be less costly to everybody, and people can get back to work and keep those shelves full for New Zealanders.
And do people go individually, or is there any suggestion that they might have to go in groups?
Well, as it stands, the system is people will be responsible for themselves. And the issue is with a lot of shift workers in food manufacturing, many don't have their own transport. Many work late hours, so your health point collection area may not even be open. It just makes a lot of sense for the businesses to be in control and to do the testing. This is what's been done in Australia and around the world. It's best practice. And this idea of people having to go out and collect their own tests may work for very, very small businesses, but not for any size, particularly not a team of 20 to 100 on a shift. Also,
if you have collection points, you have potentially hundreds of people having to go and pick up their individual rapid antigen test. What's the likelihood that that could then turn into a super spreader event? I mean, these are all people who don't know if they have Omicron or not.
Well, this is one of the things that I think was a little unusual, because say you've got your food manufacturer, you've got your shift of 20, maybe even up to 100 people, you've got a close contact, a case that's been identified, you think some of the workers are close contacts, you want to get on to making sure that they're asymptomatic, well, and pass a negative test as soon as possible. You don't want to have to say to them, look, by the way, at the end of today, could you all leave the factory and go and find yourself a health point collection store, pick up a RAT test and do your own? I just don't think that's a very efficient system.
Catherine, is there any discontent among the Food and Grocery Council members about who has and hasn't perhaps been deemed a critical worker and able to have access to these rapid antigen tests?
Not at this stage, because it's a self-identification process. But I suppose if there's any residual discontent, it's that many of our member companies planned to use rapid antigen testing last December. They had their orders in place, they had their plans ready to go, and everything's delayed because we all know where those rapid antigen tests went. Now, the whole point of having tests is to have them out there and being used, so we can keep people who are asymptomatic and well doing their job, so we can keep everything going.
New Zealand Food and Grocery Council CEO Catherine Rich. Catherine, thanks for your time this morning.